Hi, my name is Dr. Lux.
Hi, my name is Cassidy.
Nice to meet you, Cassidy. Welcome to my clinic.
Thank you.
So what I'm going to do today is perform a head-to-toe assessment on you, a full-body physical exam, and that's part of just the annual checkup that everybody should do to stay on top of their health. Have you ever had this done before?
No, I have not.
Okay, so I have here your chart, and I see that you have sent in all of the records from your previous doctor. Thank you very much for that. May I please have your age and date of birth?
22 and 12/10/99.
Perfect. Okay. And let's briefly verify your medical history. Do you have any allergies, Cassidy?
I'm allergic to some soaps and lotions and pollen.
Okay, noted. Any significant medical history like surgeries that I should be aware of? Anything majorly wrong over the years with you?
No major surgeries, no.
Perfect. Any headaches or body aches that come and go or that persist?
Recently my left arm has gone a little numb.
Okay.
Once in a while.
Right. And when does that usually happen?
Usually when I wake up.
Okay, in the morning. Do you work out regularly?
A couple days a week, yeah.
A couple of days a week, okay. Do you usually sleep on your side? Are you a side sleeper or?
Oh, I do sleep on my side.
Okay, on
Left side, yeah.
That could explain the pain, but I'll definitely check out your arms and your back to make sure nothing is wrong. And do you know your height?
I'm 5'3".
5'3". Okay, and your weight?
120.
Are you up to date with all vaccinations?
Yes.
Alright, so what I'm gonna do next is perform a quick mental acuity test. I'm going to give you 4 words and I want you to remember them. And I'm gonna then ask you a series of other questions and then I'm gonna ask you to repeat the words back to me. Are you ready?
Yes.
Okay, so the 4 words are cat, apple, house, and car.
Cat, apple, house, and car.
Yes, perfect. And 2 numbers to make it a little bit more difficult. The numbers 8 and 9, so remember those 6 things. Okay. During the summer, is it usually hot or cold?
Hot.
Hot. Perfect. And let's say I give you $100 and you go to the store and you buy apples for $49. Inflation, prices are rising, apples are expensive, so $49. How much do you have left?
51.
51, perfect. And how much did you spend?
How much did I spend of the $100?
Yes.
$49.
$49 for the apples, excellent. And what are the 4 words and the 2 numbers I gave you at the beginning?
Cat, apple, house, car, 8 and 9.
Perfect. So mental acuity checks out. Alright, so let's verify your height quickly.
Okay.
I'm gonna ask you to sit in front of me. And I'm going to use this device. Okay, that should be enough. Okay, so I'm seeing about 64 inches. So that's 12 inches, 60 inches in 5 feet. Okay, so 5 feet 3.5, I would say. Good. Okay, you can take a seat back down. Okay, so you told me 5 feet and 3 inches and a half. Very good. Right, what I'm going to do next is just take a look at your body. Just observe for any external signs of any lesions. And you said that this arm is the one that gets a little bit numb, right?
Yes.
Okay, no blues or grays, no scarring. Is it okay if I move your hair out of the way?
Yes.
Skin looks normal. I'm just going to touch you just to feel the temperature of your skin, check for any excess sweating.
Okay.
Normal temperature. Don't have a fever. And is it quite normal that you usually get a little bit flushed sometimes?
Yes.
Okay. That's part of just your normal skin response. So even normal temperature. No excess sweating. Normal temperature again on your legs. No signs of any edema. No signs of any psoriasis. Any pain in your arms?
No.
No. Okay. Just gonna take a look at the skin. In the inside. And on the outside of your arm. The temperature is even all throughout. No signs of any nail clubbing or nail pitting. Capillary refills within 2 seconds, which is normal. If you can please turn your palm up for me. Temperature is even all throughout the inside of your arm as well. Your palmar region is not pale, no signs of any palmar erythema. Just going to take a look in between your fingers. Quite normal. Okay. I'm going to do the same on your other arm. On the inside, even temperature. On the outside as well. Nails appear normal. Capillary refills, 2 seconds. Same of observations. No palmar erythema or red palms, and Next up, I'm going to focus on your head. You mentioned no headaches, nothing concerning, right, with your head region.
My head has been okay.
Okay, good. You can keep your eyes closed. I'm just going to feel your head, check for cranial symmetry, any lumps or bumps, anything that may be abnormal upon the touch.
Okay.
Head region is normal. Just going to palpate. Any pain at the top of your spine right here?
No.
I'm going to press down on your mastoid bone process. Any pain here?
No.
No lumps or bumps. I'm going to check your neck area. And your lymph nodes, which are not enlarged. Palpating above your clavicle. No nodules. Your shoulders are of even elevation. I'm going to palpate your thyroid next. Barely palpable, which is what we want. Can you look up and swallow for me? Moves up and down as expected. And barely palpable upon palpation. Very good. What I'm going to do next is a quick scalp check. Have you noticed any dryness, any irritation of the scalp, any dandruff?
No.
Oh, very good. Yeah, you can just look straight for me. No flakiness, no redness. No signs of any infestation. Hair distribution is normal. I'm going to take a look on the other side as well. No signs of any folliculitis. The color of your scalp blends well with the color on your face and on your neck. No flakiness, no signs of alopecia. And no hair loss. No, definitely not. But I'm just going to note a couple of those observations. So normal physical appearance and skin, normal scalp exam. Okay. Next up, I'm going to focus on performing a sensory exam on you. I have here a couple of different devices that I'm going to touch you with. And the first one, may I please have your palm, has two ends. This is sharp and this is dull.
Okay.
So I want you to keep your eyes closed and I'm going to touch you all throughout your body. Tell me if it's sharp or dull. Sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Very good. And do you feel this equally on both sides of your forehead?
Yes.
Equally on both sides of your cheeks?
Yes.
Equally on both sides of your jawline?
Yes.
Equally on both sides of your arms?
Yes.
And equally on both sides of your feet, legs?
Yes.
Very good. Now I have here a slightly sharper tool. I want you to keep your eyes closed and just say yes when you feel me touching you.
Okay. Yes. 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 Yes.
Very good. I have here a slightly sharper tool. This is going to be the sharpest one. And we're going to redo the same test.
Okay. Yes. 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 Yes.
Very good. Okay. And next up I have here something that's just going to propel a little bit of an air flow. Keep your eyes closed and tell me where do you feel the airflow.
Okay. On top. Below my chin.
Good.
On my right shoulder. On my chest. On my right arm. On my left arm. On my nose. On my right eye. On my left eye. On my lips. On my right ear. On my left side of the head.
Good.
On my stomach.
Very good. Okay, I have here an acupressure device. I'm going to touch you again with it to see yes when you feel it.
Okay. Yes. 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 Yes.
Very good. I'm going to touch you either on your left arm or your right one. Keep your eyes closed and tell me which one you feel me touching you.
Okay. Left. Right. Right. Left. Right. Right.
And where am I touching you now?
My neck.
Good. And now?
On both the shoulders.
And now?
On my forehead.
Okay, next up I'm going to listen to your heart and your lungs, and I'll be looking for any abnormal sounds, anything that may indicate anything systemically wrong with your valves or your lungs.
Okay.
And this may be a little bit cold, so I'm just gonna warm it up. Alright, and place it right here. And you can just breathe normally. Good. Okay, I'm hearing normal sounds coming from your heart. No murmurs. Steady rhythm. I'm hearing S1 and S2, not hearing S3 and S4, so no signs of any valve abnormalities or any signs of heart failure or anything like that. I'm gonna listen to your lungs next.
Okay.
So take a deep breath in and out. Deep breath in and out. Deep breath in and out. Good. So clean, clear sounds and no signs of any pneumonia or bronchitis or anything wrong with your lungs. So that's very good. Right, next up I'm going to focus on your eyes. Any dryness, anything wrong with your eyes that you've noticed recently?
No, but I do wear contacts.
You wear contacts and you have them.
I have them in right now.
You can keep them in.
Okay.
So I'm going to first check your pupil response. So I want you to look in between my eyes or at the tip of my nose, wherever is most comfortable. And I'm just gonna shine this light and check for how well the pupils dilate and contract. Perfect. Normal dilation and contraction responses.
That's good.
Right, next up I'm going to check your binocular vision. So I want you to look in the distance and I'm going to flash these cards at the periphery of your eyes. Try to see if you can spot the color and the shape that I'm showing you.
Okay.
So this is the first one.
Brown square.
Good. And let's try over here.
Orange square.
Yes, very good. And over here.
Blue diamond.
Very good.
Yellow diamond.
Very good. Excellent. I'm also going to take a look at the optic nerve. Okay, so continue looking in the distance for me. I'm gonna come really close, and unfortunately I'm gonna have to shine another light in your eye. Just for a second. Okay. Optic nerve is intact. It's clear eyes, white and moist. Not seeing any signs of concern. I'm gonna check the other one as well. All looking good. Right now, I want you to cover one eye, and I'm gonna hold up a number of fingers, count them, and tell me how many you see.
Okay.
And you can look at my nose. That's gonna be the easiest.
Okay. 2.
Good.
1.
Good.
5.
Good.
2. 4.
Good. And now if you can cover the other one.
5.
Good.
2. 1.
Good.
2. 2.
Very good. Right, I'm also going to draw some letters here on my notepad, and just about an arm's length away. I'm gonna draw a really big one first. Can you see this?
Yes. It's an X.
Good. And how about this little one here?
An A.
Good. And this one?
O.
Very good.
B.
Excellent. No concerns whatsoever with your eyes. I'm also going to take a look at the conjunctiva of your eyes. If you can look up for me, I'm just gonna pull on them down a little bit. Okay. Excellent. Pink and moist, and no signs of any jaundice.
That's good.
I'm gonna focus on your ears next. And I'm just gonna take a look on the outside first. If you can move your head over to your left, I'm just gonna check the auricle of your ear. Any pain when I pull down?
No.
When I pull up?
No.
Laterally?
No.
Good. No discharge, no abnormal colors, no redness. Alright, I'm going to take a look inside your ear with my otoscope and visualize your eardrum and ear canal.
Okay.
And check for any signs of any infections or anything. Well-defined margins, pearly gray color. No signs of any infection or inflammation. Normal eardrum. Good. I'm gonna do the same in the other ear.
Okay.
Better if I just sit down. Normal ear auricle. Any pain when I pull down?
No.
And laterally.
No.
Good. No external discharge, no redness. Okay, I'm gonna take a look inside. Normal eardrums. No signs of any concern. Okay. Alright, next up I'm going to use my tuning fork here. And I'm going to strike it and cause a vibration. And I'm going to place it right by your ear into positions. This is position 1 and position 2. And I want you to tell me which one is louder.
Okay.
So this is 1 and 2.
2 is louder.
And you still hear it?
No.
Good. Alright, let's try the same test over on the other ear. Position 1 And 2.
1 is louder.
Good. And you still hear it?
No.
Good. Right, then one more time I'm going to place it top of your forehead, and I want you to tell me if you feel the vibrations in both of your ears equally.
Okay.
Right in the middle.
Yes, I feel it both equally.
Okay, that's good. Excellent. Right now I want you to keep your eyes closed and tell me if you hear a sound in your left or your right ear.
Okay. My right ear. My left ear.
And can you try to point with your finger to where you hear the sound coming from?
Okay.
Good. Very good. Right, I'm going to focus on your nose next. Have you noticed anything wrong with your sense of smell ever?
No, but since it's been cold, I've got the sniffles.
Oh, okay. So let's take a look inside. Okay, no discharge, no inflammation. I'm going to obstruct one of your nares. Can you take a deep breath in? Good. And now with the other one. Okay, so this one is a little bit clogged. I'm going to give you something to smell, and I want you to try to identify the smell.
Okay. It smells like coffee.
Okay, and if you can cover one of your nostrils. I'm going to try to give you this one.
It smells like my grandmother's cookies.
Cookies. Excellent. All right, next up. Right, next up I'm going to focus on your mouth.
Okay.
Any dryness, anything wrong with your mouth?
No.
All right, I'm going to take a look inside. And see if you have any inflammation, any signs of strep or anything abnormal.
Okay.
Okay, if you can open your mouth and... Right, perfect. No signs of any inflammation.
Good.
And can you try to push your tongue through your cheeks right here? Good. And over here. Good. Excellent. Right. Very good. And can you puff out your cheeks for me? Keep them puffed, don't let me unpuff them. Okay, very good. Oh, you're getting red really easily.
Yeah, my skin gets red really easily.
I have the same thing. You can't really see right now. I have a little bit of makeup. Get the same thing. I flush immediately. Can you raise your eyebrows for me? Okay, keep them raised. Don't let me lower them. Good. And I'm gonna attempt to move the head side to side. Don't let me do that. Resist. Okay, very good. And the other one. Very good. And shrug up your shoulders for me. Good. Okay. And can you move your arms like this parallel to the ground? Okay. Any pain right here?
No.
No. Okay. I'm going to attempt to spread them. Don't let me do that. Resist. Good. And now I'm going to attempt to bring them up. Don't let me do that. Good. Oh wow, your back muscles are really strong.
Thank you.
And I'm going to attempt to push down on them. Don't let me do that. Good. Can you keep your arms like this? Any pain here?
No.
Good. I'm going to try to move them up. Don't let me do that. Very good. And spread your fingers wide. I'm going to attempt to bring them together. Don't let me do that. Good. Oh wow, you have a lot of strength in your arms. Good. All right. Next up, I'd like you to lay down.
Okay.
So I can take a look at your tummy, auscultate, palpate, and percuss.
Okay.
Okay, Cassidy, are you nice and comfy?
Yes.
Good. All right. I'm going to begin by palpating your tummy first. Is it okay if I pull this up a little bit?
Yes.
Okay. So I'm going to begin with the light palpation first. Go ahead and just breathe normally. I'm looking for any masses or any abnormalities upon palpation. And I'm also evaluating the size of your internal organs. Any pain when I do this?
No.
Good. I'm going to do a little bit of a deeper palpation next. The size of your stomach is normal. Normal size of the liver as well. And patient does not note any pain upon palpation. Right. I'm going to listen with my stethoscope next.
Okay.
Right. Go ahead and just breathe normally. I can hear a normal level of activity. Quadrant 1, 2, and 3. Okay. Activity is heard in all 4 quadrants. And no gurgling or swooshing sounds. That's good. I'm also going to percuss. Let me know if you feel any pain.
Okay.
All normal sound. Alright. I'm going to touch with something sharp again on your tummy. Just say yes when you feel it.
Okay. Yes. 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 Yes.
Right, this is sharp or dull?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp.
Okay, do you feel this?
Yes. 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 Yes.
Okay, I'm just gonna take a look at the skin on your abdomen. And your arms. Right. I'm gonna focus on your legs next. Normal temperature. Gonna check the pedal pulse. 2+ synchronized. I'm going to attempt to move your fingers towards your head. Don't let me do that. Good. And now I'm going to attempt to bring them towards me. Don't let me do that. Good. Alright, keep your eyes closed and just say yes when you feel me touching you.
Yes. 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 Yes.
Good. So normal sensitivity. Going to inspect the skin. No redness, no patches of dryness. No signs of any edema. No abnormal moles. No sign of any nail clubbing or pitting. Capillary refills within 2 seconds, which is normal. Okay. Do you feel this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
Alright, and do you feel this? And this? And this?
No.
This?
No. Oh, yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
This?
Yes.
This?
Yes.
Good. Do you feel this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
Good. Plantar region is normal in both of your feet. Any pain when I press down on your plantar region?
No.
Good. And here?
No.
Alright. I'm going to attempt to spread your legs apart. Don't let me do that. Good. And I'm going to attempt to bring them together. Don't let me do that. Excellent. Alright, you can come back up now. Right, Cassidy. So I did a very thorough examination of your whole body. I focused a lot on a sensory assessment. I'm not able to find anything abnormal, so I'm happy to report you're 100% healthy.
That's good, thank you.
Do you have any questions for me?
Should I stop sleeping on my left side?
That's a good question. I would try changing sides for a little bit just to see if the numbness goes away. I'm pretty sure it's because of your sleeping position, but do try to flip it and sleep on your right side and see how that is. If the numbness doesn't go away, then come back and see me so we can reevaluate you.
Okay, thank you very much.
Thank you as well. It was very nice seeing you.
It was very nice seeing you too.